Welcome again to Myth, Magic, Medicine, Season 3, which is two immigrant doctors talking. And my guest today is Anca Sisu, who is from Romania. Hi, Anca. Thank you so much for joining me.
Hi, Denise. Thank you for having me. I'm excited to have this talk with you.
Have you done many podcasts? A lot of our fellow physicians now have podcasts.
Not very many, just a couple.
Mm-hmm. So when did you arrive in the US?
About 20 years ago. Soon it's going to be 20 years.
Okay, and it was right after you finished training in Romania?
Yeah, so I finished training and then I did about 8 months of residency there, and then I moved.
Okay. Okay, so let's try and be organized. It's not really my forte, but let's try and be organized. So you grew up in Romania. You're much younger than me, so you didn't experience communist regime as much as many of my friends. Can you talk a little bit about the history of Romania and then the history of medical training in Romania? Because I know your school's been around since the mid 1800s.
Right.
Yeah.
Yeah, so, I grew up in a small town near Danube, and, when communists fell, I was 12, and, I got some of it, and through my parents, through the stories, and through some personal experience. And then, things started changing for the better,
Mhm.
and we gained our freedom, and with that comes some responsibility and some changes, and resistance from some people and excitement from the younger people. And yeah, so it was in a way a pretty clear path. I loved helping people, and from an early age I wanted to be a doctor, and then I applied to medical school, which is in Bucharest, about 3 hours away from where I lived, and I moved there for the 6 years. We do 6 years of
Right.
medical school there.
Point out because many people don't realize the differences in what you learn in medical school. Very little. Most people learn the same stuff, but how to get to medical school. Medical school follows immediately of the equivalent of high school, right? You
Yes.
went from high school into medicine. Was there a particular entrance exam you needed to take, or okay?
Yeah, it was a pretty tough entrance exam. You have to take biology and biochemistry and physics tests, and I prepared for that for a couple of years.
Mhm.
And they only took a certain number of people. There were the year I took the exam, it was just a quarter of the people got admitted, so it was a pretty tough exam.
Mhm. How many people were in your class, your entering class?
Um, well, we were, I don't remember exactly, about 500.
So it's pretty big. And how many
Mhm.
medical schools in the country as a whole?
I think about 5 or 6.
Okay. And most of them do take foreign students as well, certainly now.
Yes,
That's nice. And you were in the capital city at Carol Davila?
yes, that's
Okay. Was that because that was
the
the closest
oldest.
one to your home, or you just wanted to be in the capital?
It was both. It was, I like to believe the most reputable. Of course, other people will argue that their school was the best, but and it was closer to home, and it was important for me to be in touch with my family and be able
Of
to see
course.
them some weekends.
Yeah, that's good. So you start school there in October. School year starts in October, right? The
Yes.
academic year. How many months of the year did you study?
It ends in June,
Okay.
so you
And
have,
then,
it's
uh-huh.
actually, yeah, September, mid-September, that you start back.
Yeah, I must do disclaimer. I have a family member who went to Romania to study medicine. I remember he was required to do a certain number of weeks during the summer, which he could do in the US,
Hmm.
but he had to summer volunteer from the first year of medicine. Was that true for you also? Did you have to
Y-
work in the hospital during the summer?
it was optional in the first 3 years, and then
Oh, okay.
I did it for, to gain more experience, do an
Mhm.
internship.
It's possible it was optional for him, but he certainly didn't let me know that. So, um, okay. So, what were the first things? Do you think there's any difference having now had experience meeting with medical students here who are training in the US. Do you think there's any difference in the way the curriculum is set up from the US?
Yeah, so I trained 20 plus years ago, and we didn't have so much access to like high quality books. You had books that were underlined with 3 different colors, and you were lucky to have a newer one.
Mhm.
And there was less study materials, I would say. You can see here, the skeletons, the pelvis, like all the bones, and we had like real bones in anatomy
Mhm.
that we
Yeah,
had to
my
study.
that's way back. I graduated 40 years ago. We have real ones too.
Mhm.
That's not allowed anymore.
Yeah, yeah, I know. Yeah, so yeah, I think we had to figure out way more, and especially because internet was not available when I was
Mm,
in school. We relied heavily on books, and our professors, teachers had to give us extra materials, and
okay.
yeah, it was different. I think the access to technology make things much easier nowadays. You
Yeah.
could.
Actually, my question really was more, did you think that the order in which they approach it, my school, anatomy, the first 2 semesters, it was like 60% anatomy and all the other subjects fit around it. Is it similar for you? Is the order of presentation of the work the same, do you think, as here?
I think it's similar. I think we were one of the highest. We had the highest number of anatomy hours actually in Europe. When I looked at the study, they were saying it's Romanian schools, and it felt like a lot. While
Well, when you're
going
going
through it.
through it, it always
Yeah.
feels like a lot.
I
Live
think
through it.
overall it's similar, but the number of hours allocated to each discipline is different.
Mhm. How many years or hours, if you think in hours, did you have before you actually saw your first patient?
Well, in the first 3 years, it's more theory, and then you start seeing patients. So I'd say in the third year, you're
You
actually
you start to
with
do
patients.
rounds
Yeah.
with people.
Hmm.
Mhm.
Hmm.
And is your last year of medical school setting you up for a license? Is that like an internship year? Is it all clinical at the end, or is that different now?
Yeah, so I would say, in the last 3 years, you do clinicals and you take tests based on those clinicals. But the last year, it was a mix. I mean, we just finished. You rotate through all the specialties pretty much, and then you have an exam to get into residency, and that exam was pretty tough too. And I think the system there is much different, where the top people get to choose their specialty, and then it's kind of a sliding scale. So if you don't have a really high score, then you might not get into the residency of your choice. There's no matching process like it is here.
Do you have the opportunity to declare what you would like to study prior to the exam, or do you have to wait for the results?
Yeah.
So you say, I'm looking to do this, and they say, sorry, no, you
Yeah,
can't.
because there's actually a track for surgical specialties and a track for medical. And so, I opted for medical, and you can put your option there, but
Mhm,
they're gonna give it to you if it's available.
mhm. The postgraduate training there, and I know you only did a little bit of it there, but postgraduate training there is you come out, do you do a year in general medicine, or do they specialize you right away
They start specializing you right away. Yeah.
within what we would consider a subspecialty of medicine? Do you come out and do internal medicine, or do you do hematology, or do you do, is
Oh,
it
I see what you're
separated out?
saying. Yeah, so you would do internal medicine in the first year if you're in internal medicine. Yeah, I did family medicine, and so you have to have the rotations in the hospital, and it's a certain curriculum similar to here, I would say, and you have to go see patients in the clinic as well.
At what point in your studies did you realize that you wanted to come to the US to get graduate training?
Well, it was in my third year of medical school, when I got the opportunity to come to United States. My godparents were here in California, and they invited me over. So it was an eye-opening experience for me. And it so happens that their son was a physical therapist. So looking at his books, he had a pathology book that I really loved. And he ended up gifting it to me when he said, so you just read that book. It's just take it. I'm not gonna
I'll
buy
get another
another one
one.
if I need. But, I was so fascinated to see the explanations and the graphs and the pictures and in a way, it was, much easier if you're passionate about something to follow your passion. And then, I kind of made my mind on the way back home that I'm gonna be back. It was, when I got back home for a month, I was myself. So my mom is like, "What's going on with you?" And I said, "I'm just gonna go back." Um,
Hmm.
it was a sad deal. I just didn't know how, but I knew I'll find a way.
And what path did you just obviously I know the answer to this question, but for the purposes of the interview, what did you decide was going to be your path? Because getting as a physician and getting to the US from an immigration point of view can be quite difficult. What did you decide would be the best route for you?
It was interesting. My godmother was also in the medical field, and she was telling me that nurses are in high demand. And she said, there's a lot of recruiters who bring nurses here to the United States. And that kind of planted a seed to say, well, maybe, if I'm a nurse as well, that might be a good transition for me to be able to get a job and land in a hospital and then figure out what I want to do. And, I applied to nursing school in my third year of med school. And, I did courses at the same time, which is a bit
The
crazy.
same at the same school, the same university?
Well, it was the nursing school, but it
Right,
was
but
in
so
Bucharest. Yes.
I'm just trying to imagine somebody in the accounting department trying how she's studying both things at the same time. Um, but nobody noticed or nobody minded that you wanted to abuse yourself even more than medical school? Because
No, I mean,
medical
there
school
were
is pretty
some.
pretty rough.
Yeah, there were some classes that I could transfer, and then it was the extra the practical aspects of nursing that I had to do, and
Mhm.
I was able to fit that into the schedule in the evenings, afternoons. So don't ask me how many hours my
Yeah,
how
lots
long
of
my day
lots of
was.
hours. So you graduated from both at the
Yes,
same graduation ceremony. You walked up
yes,
twice, huh? Okay. So, but once you finished that, you worked as a physician once you finished the exam.
yes.
Okay. Did you work at all as a nurse once you had graduated? Because
Not
you
in
have that
Romania.
waiting for the results period. You have to quite a long period there. So
Yeah, so I got my diploma, nursing diploma, and I took the test for the medical residency because I really wanted to start training in family medicine, and I didn't know about, how the timing, what's gonna happen with the nursing, and I want to make sure that I'm actually, continuing on my medical path there
mhm.
while I was researching ways um, to go to United States as, a nurse, as a doctor. So it's the medical field in Romania didn't pay much at that time, and that was another
Doesn't pay
factor.
much still, but
Yeah.
yeah. At what point did you start the actual paperwork trail to get yourself to the US? Did you go to a recruiter initially and ask if you could come over as a nurse? How long did that process take?
Well, I got in touch with some recruiters. I actually convinced some of my colleagues when, like, back in the third year of medical school, and when I started doing the nursing process, I had a couple of friends who were also thinking to immigrate. So I showed them what I'm going to be doing. So they followed along, and so the three of us were applying for nursing jobs and looking for recruiting agencies, and we found an agency that was recruiting for North Carolina.
Hmm.
We did the paperwork, and you had to take their CGFNS exam, which is, to become a nurse in the United States. So we're preparing for that together, and got all the materials, got all the paperwork together, and then they ended up pursuing that, and I ended up finding my husband, who actually lived in the United States, and I had a little detour.
Okay. So when you arrived here, did you come over and get married, or did you get married in Romania and
We
then?
got married in Romania. He's Romanian.
Yeah. So you came here as a new bride, and what did you do initially? Did you get a nursing job, or did you just buckle down and study for the American exams? What did you do?
Yeah, so as a because he had a work visa H4 and or H1B, and I was a spouse, I didn't have the right to work, so
Mhm.
I had to be done with all the exams and be accepted and find a nursing program. So I had to study for the tests and apply to different jobs, and so that took me a little while in and find somebody who wanted to take new graduate. I was considered a new graduate. So
Mhm.
yeah, I ended up working at the hospital on their medical surgical floor and orthopedics.
What does your husband do?
He's a software engineer.
Oh, okay. Completely different. All
Yeah.
right. So did the North Carolina, he was based there or?
No, that was the recruiting agency. So
Oh,
yeah,
okay.
I ended up giving that up.
So where did you first live when you came to the US?
I first lived in Dallas, Texas for a few months, and then his job transferred to Seattle. So he lived in Seattle for about 7 years.
Okay. So American licensing exams are federal level. So you could study there and then transfer up and do that. So at what point did you, where and how did you find your way to a residency program for medicine? How long did it take you to get through the slew of exams that you must take if you're coming? Because Americans don't really, take the first one after the second year of medicine, and
Mhm.
the second one at some point, usually around your third year, because you've got to get paperwork in for the end of the fourth year. But if you're coming abroad, having already done 7 years of medicine,
Yes.
you've got to do all three exams as
Mhm.
fast as you can. How long did it take you to get through them?
Yeah. I would say a couple of years of intense studying, like almost a year for each of them, and the second and the third, I tried to pass them close together because I was pregnant at that time, so that added just a little pressure,
Yeah,
and
just a bit.
um,
Don't give me my due date for an exam date, please. That wouldn't be good. No.
exactly, exactly. But yeah, I mean, it was a process with the paperwork, and actually, in the first 3 years of nursing, I really liked what I was doing. So I was contemplating, continuing to work as a nurse, but also figuring out the medical system. And I had an appointment with a primary care doctor when I landed in, like, after a few months in Seattle. And I had a list of 6 different things I wanted to talk to her about. And after the first two, she left the room, and I wasn't sure, like, is she coming back? And then the nurse said, time is up and you just have to make another appointment. And, I was a little surprised to hear that. And because back home, the doctors will answer your questions. And even if you were waiting a little longer, you knew that they will
Yeah, come
answer your
back.
questions, they will come back. And so after that experience, I talking to other people, I realized that that's all the time the doctor was given. It wasn't her fault that she had to leave the room. She had other patients waiting for her. And I was a little discouraged with that because I felt like that would not allow me to take care of fully of my patients and having the
Hmm.
time limitations. So I had to think really hard about actually going back to medicine because I felt very strongly that I cannot practice that way.
Hmm.
And to the point where I felt like, okay, if nursing is giving me the time with the patient that I need, then I was actually enjoying what I was doing quite a bit. And then I was fortunate enough because I had some health issues to find some inspiring physicians who were practicing differently, and
Hmm.
that kind of was the change I needed, or the inspiration I needed to change course. And I started studying for the boards. It took me a few years to kind of decide that, okay, this is what I'm gonna do. That's why the process took me about 5 years
To do
before
all the exams, or from when you got here it took 5 years.
from when I got here until I
So
I
you were on the cusp of them being nasty about when you finished school then, because they usually give you about 7 years to get through the process. If you,
yeah, yes.
yeah.
Yeah, I think, having the nursing experience has really helped. And,
Hmm.
the doctors I worked with in the hospital really encouraged me and wrote nice letters. And y- I kind of knew that I wanted to do integrative medicine because of this decision to say I'm going to do things a little differently, and if I find an program that has integrative medicine incorporated, um,
Oh,
the
where did you go?
so I initially applied to all of the 8 programs that were with Andrew Wiles, integrative
Hmm.
medicine and residency. He had that. He has a fellowship, and he has that program too. With the initially the pilot program had 8 places, and one of them was Maine Dartmouth integrate program in Maine.
So you go into a family medicine, but it's got a segment that's for integrative medicine.
That's right.
Okay. All right. And so you got into that one. What happened? Your husband had to work remotely, or you just moved away because it's the other side of the country?
Yeah. So we had to move over to Maine because we had the 2-year-old at that time. So we wanted to keep the family together.
Yeah. But software engineers usually don't have too much trouble finding jobs wherever they want to be, and they usually can work remotely, which is nice.
Yes.
Yeah. So you did that. What was still striking you as different from the system, both culturally and as a medical professional in your own country? Which ones struck you the most, aside from, I'm sorry, your time is up, um, the constraints put on doctors? I don't think most doctors want to practice medicine by a clock. We want to be able to give the time that's needed. But of
Right.
course, if you've got 5 people waiting for you, you also have to respect their time. So it's difficult.
Yeah, so I think it was the intensity of the training of the residency training with the 80 plus hours that we got in the
Mm-hmm.
in the first year, and just having to keep up with so much information in a short amount of time, which I felt was not so intense in Romania. So it was a little different pace there.
Mm-hmm.
And keeping up to date with the technology and the latest guidelines and all that. I feel like, yes, we do have guidelines in Europe, but I don't think we were so pushed to like check all the boxes, and so it was a little more relaxed, versus here, where I felt like it was a huge responsibility, where if I didn't cover everything in the during the visit, like all the checking all the boxes, that's gonna reflect negatively upon my review, which I'm
Do you think?
competitive, and I try
Yeah,
to
yeah.
keep it
Well,
up.
most doctors are, but it's a side effect of the training. But do you think those boxes are genuinely addressed? There's a lot of boxes on those forms.
Mhm,
And
mhm.
I'm now nearly 70, and thanks to the new and improved version of Medicare that we have currently, I get a whole wellness exam every year, and they remind me every year to go to my doctor and make sure nothing's wrong. But I can only address issues that we've already diagnosed. I can't bring up a new subject because that's not a wellness exam.
Yes.
Bonkers. And thankfully, if I want to see the doctor, I will get out my credit card and see one. But for a lot of people, that is not the case. That wellness check needs to be a safety net for a lot of our population. What aspect? I know you've decided that you want to have your own way of practicing and not deal with that, but can you address that whilst you were in training? Did you feel that your non-affluent patients had access to doctors in the way that they would have had they been in Europe? Or do you think is the same but different sort of problem in Romania also? You left before they joined the EU, so
Right. Yeah. So, I think there is more of what this patient needs in the moment in Romania. What are their pain points versus I got to check this box, and otherwise you'll have to come back. Um, and here, yes, ultimately you're under those time constraints, and you gotta go through the questionnaires and make sure you have all the screenings done. And then if people have an acute problem, that's when I would get into trouble, because I was trying to address it. And
Mhm.
you have the choice to do that and get behind, and not be, of course, reimbursed for that extra time that you're spending, or follow the rules and have the patient come back, which was tough because I only had the number of patients or slots in the clinic, in the following weeks. And if that was something more urgent, a colleague of mine would have seen that patient, and the medical care was a little bit spread out to like several practitioners, and of course the patients in residency were okay with that because they knew the system. But in other practices, they want to see their doctor and they want all their concerns addressed, because the other aspect is that patient takes time out of their schedule to come see you, and might not be so easy to come back.
Yeah. Okay. What other differences have you found? Initially, 20 years is a long time, but what do you miss about Romania, both in practice and in just general society? My favorite thing, I went when my son was there. I've probably been to Yash 5 times and to the country 7. And my favorite thing is the very relaxed dining habits. You go for dinner, they look at you. If you want something, you can wave, but they leave you alone. You can spend 7 hours in a restaurant, they'd be fine, even if you didn't order anything.
Yeah, I think
rushed eating is a big thing here.
Exactly. I think everything is so scheduled here, and I miss the enjoying life kind of aspect of things back in Europe. And yes, you should be on a schedule there, but it's not as tight, and my days didn't tend to be so full there. And yeah, it's interesting just culturally. Here, when you ask somebody how are you and they say fine, you don't know if they are fine or not. Over there, when you ask them, how are you? You've got to be prepared. You've got to have 15, 20 minutes for them to tell you, what happened to their neighbor or cat, or what happened in their lives. 'Cause that's what, that the answer to that question is how are they actually feeling? What are they doing? So it's like, oh, here, if you don't feel well, you're getting a therapist there. You're just getting your neighbor or your friends to listen to you.
Yeah. Do you think there would be as much of a need for integrative medicine practices in Romania as there are here? Do you think it's already being practiced? Are they bringing in the other modalities into practice?
Yeah, I was actually surprised when I went back home last summer. I went with my father to a neurologist, and part of the recommendations were some herbs and vitamins. And this was just he wasn't an integrative neurologist, and there's not much of that advertisement there. There's some clinics in Bucharest that are more integrative, but I feel like it's part of blending in the best modalities we have. And if a supplement is pretty good, then they are gonna recommend it. And it's not like frowned upon here, as if it doesn't have this many randomized control studies, then we're not going to incorporate it in our recommendations. And it's a lot of herbs that actually have that, but it's just about the awareness that as doctors we might not have had the time to read the articles or the studies, and didn't have exposure. Like, I'm pretty fortunate to have had that in residency and to see that it's actually a lot of the complementary medicine modalities have been around for a number of years and are pretty effective.
I'm very happy that as a hypnotist, which is my current thing, that there are quite a few hypnotists who are doctors whom I know. I was at a course once, was about 8 of us, and one of the people her name is also Anca, I think. she's in Bucharest. She's a hematologist. Oh no, she's a hypnotist as well. So interesting combination. But yeah, I was very happy to see that it was being taken fairly seriously by most of the medical practitioners there.
Yeah, and I think the old traditions also play a role, because my grandma was treating me with chamomile tea and all kinds of herbs when I was sick. And when you get exposed to that at an early age, because we're under communists, we didn't have so many resources. You had to figure it out, and you had to be very resourceful to treat yourself when you had an illness, and go to the doctor only when it was something significant. So the herbs used there, and other healing modalities were very present when I was growing up.
Yeah. So now that you're in practice in the US, do you have an integrative practice, or is that sort of a sidekick to what you're doing? What are you currently? How are you practicing medicine?
Yeah, I have an integrative holistic practice. So I trained with Institute of Functional Medicine, which gave me the framework to practice integrative medicine. And then, the training I had in residency helped me kind of put different aspects of modalities of integrative medicine together. Like I do some acupuncture, some osteopathy, and, nutrition. And ultimately, I'm looking, as many doctors are, to help people restore balance in their bodies. And yeah, it kind of stuck with me. The more you learn in medicine, it is like trying to fix all these little things, but ultimately, the body is such an amazing system that it knows how to rebalance itself. And I think,
If you give it the
if you give it the
opportunity.
opportunity,
Mm.
and yes, and if you find the root causes or things that are out of balance. So that, I think, ultimately that's my goal with my patients. And so I name my practice Restore Balance for that reason.
Good. And you have the usual sort of office hours. Do you have hospital privileges? Do you see people in the hospital, or are you purely office?
I don't. I'm just choosing to stay in the office and have people actually have a primary care physician, and more like a consultant for people who haven't been helped by my the specialist colleagues and the primary care. And there's a lot of people who want to include nutrition and supplements into their regimen, and they don't know exactly how to do that. So that those are the things I help them with. So it's mostly an integrative practice, and I spend quite a bit of time with each patient. And I had to choose to be a cash practitioner to be able to do that.
So you don't take any insurances.
I'm considered out of network, so I don't bill insurances directly. I give
Does
people.
does that mean you can't see Medicare, Medicaid clients? That's just not
They see me, but they are not going to be reimbursed by the
okay.
insurance.
Right. So they choose to see you.
Yes.
Okay, what else can I ask you? Got lots of questions about Romania. How much of your own country did you see before you left? You were in the books all the time. Did you get to tour much?
Yeah, it's probably half of it. It's where the vacations take you
I
and
think
the
most people
family. And
most people don't have a very good sense of geography and don't realize how huge Romania is by European standards. It's a
yeah,
physically big country.
yes, yes, and we have mountains and the Black Sea, and it's beautiful there. And yeah, we want to visit now more often with my son, and because he wants to know his roots, and we
Of
want to
course.
travel to places we haven't been. And so the tourist has flourished there, and there's a lot of nice places to visit, and a lot of history, of course.
Hmm. Yeah, I was really didn't know anything other than Queen Marie because she was British um, until I actually was in Yash, which is pronounced Yash but spelled IASI. For those of you
Yes.
who can't figure that out, um, it's on the Silk Road, which completely amazed me. It's just a medieval city. It's a beautiful city with a lot of Soviet buildings and a lot of
Hmm.
modern architecture now, but some
Hmm.
beautiful, beautiful churches. It's an absolutely lovely place.
Yeah.
And really cold winters. I don't ever want to be there in the winter.
Yeah. Well, not as cold as Maine here. Like,
Yeah, that's true. I used to work in Mejia. I used to do locum work, and I would go
mhm.
up and spend like 2 weeks up there and then fly back again. Spending a lot of time in Boston Airport snowbound because we were
Yes.
couldn't fly out. But where in Maine were you in? Where
I
is?
was in Augusta, Maine, so that's the
Okay,
capital. Hmm.
yeah,
Yeah, we had a really good time there. It was a great group of physicians and heart centered. And yeah, it's the training in residency is hard, but the people there made it much more doable. And yeah, their caring attitude really impressed me, because it was late. They would see you how tired you were after a call, and then sometimes you had a delivery after that 24-hour call, and you're just barely
very
keeping your
functional.
eyes
Yeah,
open. And so it happened to me that they said, you look very tired, just go home, we'll take care of your
yeah.
patients.
Now, okay, so let's look back. Looking back, what about our restrictions for residents in training there? I know you were only in training very briefly, and as a medical student, you would have had more time off. But as a resident there, what sort of hours did you have? Scandinavian clock hours. Sorry, my shift is finished. Somebody else is coming in to take over, or did you stay there until that case was finished?
You mean in Romania?
Yeah.
Yeah, so we had more like clock hours in the first year of residency. So yeah, you go home when the shift is over and somebody will take over.
So how many hours a week do you think was resident time? Not study time, because of course that's on top, but
Probably 50 to 60.
yeah. Okay. So what would be ideal here, but it's never been reached? I was before there were work caps, so 100 hours a week was pretty standard when I was an intern. Amazing. Now I can't stay upright, never mind with my brain engaged anymore. That work schedule. So thank you. Is there anything else you would like to tell people before we go?
It's interesting looking back at my life, and your podcast kind of made me reflect a little bit to say, well, it's a journey and taking it one step at a time. And I wouldn't have seen myself here with a private practice 20 years ago. And it's just enjoying each step of the journey. And being a medical doctor is stressful, but I think it's also the joy of helping people and learning so much.
It's a privilege in some ways.
It is, and it is a gift for me. We're getting ready to move, and we just found some boxes, and there was a letter from the front desk people at my I actually worked a few years in Maine after the residency training, and saying patients were calling very upset that you're moving to Virginia, expressing their gratitude to the work you've done. And it's those little
That's
things
lovely.
that bring me joy nowadays. It just brought tears to my eyes to say I actually made a difference and people would remember me, and all this hard work and training is worthwhile. And it sounded from what she wrote there that I made a difference in people's lives, which it's like, yes, it's a lot of effort, and you remember that, but you also remember that the smile you put on people's faces and how grateful they are. You gave them a different path forward.
Do you think any of your children will go into medicine?
We'll see. We'll see. I think it's my son is more inclined towards technology, so
leaning software. Okay.
Yeah, so we'll
That's
see.
That's a huge field within medicine too. Really, there's all sorts of things. But do you think your kids will go to Europe to do any of their tertiary education?
Well, that's an option, and that's why I want to expose my son to the life in Europe a little bit to see if he likes it, and ultimately it'll be his choice, but I want him to make an informed choice. And the pace of life is a little different there, so he might enjoy that. We'll see.
Yeah. Thank you so much for joining me today. Thank you.
Thank you, Denise. It was a pleasure.
Thank you for joining us at Myth Magic Medicine. If you have found this episode useful, you can apply for free CME credit through the link provided in the transcript. If you're not a medical professional, please remember, while we're physicians, we're not your physicians. So please consult with your own healthcare professional if you think something you have heard might apply to you or a loved one. Until next time, bye-bye.